Hi, I'm Rachel Jantia, geriatric medicine faculty in the McGovern School of Medicine, and this is the ICARE Geriatrics module, the 4 M's of age-friendly health systems with a focus on mobility. Our objectives are to understand how falls and injury prevention are critical to the mobility of older adults, to help clients ascertain their risks for mobility impairment and falls, and to describe strategies to optimize mobility and prevent falls in our clients. Mobility is the ability to get where you want to go, when you want to go, and how you want to get there. Falls and motor vehicle crashes are directly related to mobility and are the leading causes of unintentional injury and injury-related death in older adults in the United States. And you can see there that Texas is among the highest rates, between 30 to 35% in the year 2018 alone. In that same year, 1 in 4 older adults reported falling. More than 8 million falls required medical attention or limited physical activity, and more than 32,000 older adults died from falls in that year alone. That's approximately 88 older adults per day. Falls are not benign. Medical costs associated with falls are about $50 billion annually. So that's why we care about it. Now let's think about mobility and function with respect to activities of daily living. Mobility impairment can affect far more than a person's ability to just move around in their environment. Difficulties with mobility can affect their ability to engage in social activities and activities of daily living, including the basic activities and the instrumental activities. So mobility impairment can cause challenges in a person's ability to independently bathe, dress, eat, go to the bathroom, groom themselves, and even walk without assistance. At a higher level, it can impair one's ability to cook and clean, maintain their home, go shopping, driving, manage their finances, manage their medications. If you can't do these for yourself, it causes big problems. This is why mobility is important. I have the 2 little characters on the screen to help you remember that your basic ADLs are the things that you might expect maybe a 5 or 7-year-old to be able to do for themselves, a young child. And likewise, the instrumental activities of daily living are things that you might be able to expect like an older teenager or a young adult to be able to do independently. Just a memory device for you. Impairment in any one of these ADLs may suggest physical or cognitive impairment that is limiting mobility and function. So this is one thing you definitely want to ask your clients about and refer them to their healthcare provider to address them if they're experiencing them. So who's at risk for impaired mobility and falls? Anyone who has reduced physical health overall. Certainly if you have vision loss, if you're not seeing very well in your environment, you're going to be higher risk. People who are taking many medications, or in particular high-risk medications, and if they have polypharmacy, especially medications that cause dizziness, low blood pressure, and confusion. Those people who have gait or balance difficulties, problems with their foot, ankle, or really the entire lower extremity. Chronic pain can impair your mobility. Having problems with vitamin D deficiency, and any of these chronic conditions will increase your risk of limited mobility and falls related to the complications of them. I highlight osteoporosis because it's a double whammy. So if you have limited mobility or high fall risk and osteoporosis, you're not only at risk of falling, you're at risk of falling and having a fracture that could be detrimental to your health and increase your risk of morbidity and mortality even higher. So it means we have to pay particular attention to that. How can you help your client identify if they are at risk for falls? Well, there are some questions that you can ask to be specific. One is, have you had a fall in the last year? And the other is, are you afraid of falling? If your client answers yes to either of these questions, they are at risk and should speak to their healthcare professional about how to reduce that risk. You could talk to them about fall and injury prevention too, and about how to reduce their risk. One would be to make sure that they're seeing a doctor regularly, to have a physical exam, look for those chronic medical conditions and how to optimize them, do a vision exam, and do a medication review. We've talked about how medications can be quite dangerous for older adults and many of them increase the risk of falls. So that's a very, very important piece of this. Engaging in exercise that improves strength and balance will help, such as the chair ride, which we have some information about in the client resources, engaging in Tai Chi in particular, and getting a prescription for physical therapy or occupational therapy from your healthcare provider can be useful for this. Using a mobility device, if it is advised for you, will help prevent falls. For example, walkers and rollators. Some people think that canes help with balance. Canes do not help with balance. They help with pain, offloading weight on a joint that is painful, but it will not help with balance. Implement home safety measures. So simple things like having objects, cords kept out of the way of the walkway, getting rid of loose carpet and rugs that can just be a trip hazard, and consider installing mobility devices like handrails on the stairs and in the bathroom. And then if a person is still driving, making sure that they're engaging in safe driving practices and that they have planned out alternative means of transportation in the event that they are no longer driving. Maintaining physical activity is a huge part of maintaining one's mobility as they age. And it is recommended that older adults engage in what we call a multi-component physical activity. That means checking all the boxes, doing things that include balance training and aerobic training and muscle strengthening will be the best modality to maintain physical activity and decrease risk from falls and injury from those falls. Bonus is, especially with muscle strengthening activities, that it reduces the risk of osteoporosis so that if you do fall, you won't have a higher risk of fracture. So here are some examples on the screen that you can share with your clients about ways, specific types of aerobic activities they can choose from, and one that works for them, and the specific types of muscle strengthening activities that they can choose from as well.